Welcome back to County Connection. For this final segment of our August episode, we're going to be talking about the school-based health centers. And here to tell us all about it are Mackie Wong, who is a family practice clinician and the school-based health center medical director. Welcome, Mackie.
Thank you. Thanks for having us.
And Jenna Worthen, the school-based health center director. Welcome, Jenna.
Thank you. Thank you.
All right, so we are going to be talking about some back-to-school services at the school-based health centers. But before that, could you start off by just giving us the broad overview of what are the school-based health centers?
Yes, so we have 6 school-based health centers. 4 of them are in Summit Community Care, or in the Summit School District, Summit High School, Summit Middle School, Silverthorne Elementary, and Dillon Valley Elementary. We serve students and their families, staff and their families. So we will see quite a few people. It's not just for students. We see anyone regardless of your insurance, your ability to pay, and we do medical, dental, and behavioral health services in the clinics. Let's see, what else?
The other 2 are in Park.
We have 2 other
Leadville.
clinics in Fair Play and Leadville. And again, behavioral health, dental, and medical. What else am I missing?
So are those services, so let's say if I have kids at multiple schools, and I'm looking for health services myself, then can I go to any of the clinics, or do I have to go to the ones that of the schools that my kids go to, or how does all that work?
It's a great question. You can access any one of the schools as long as it's in that same district. So,
okay.
Yeah.
Perfect. And then what are some of the benefits of school-based health centers in general? Because this concept isn't unique to Summit County, so we kind of know about the benefits through research that goes on all around the country.
Yeah, the biggest benefit, I think, is kids do not have to leave campus to go to a doctor's appointment. It decreases their time out of class. So instead of being gone for a half a day or a full day for a dental appointment or a doctor's appointment, they can be gone for an hour. And a lot of the appointments, parents come to some appointments. Sometimes they don't need to, depending on their age. So that helps parents when they're at work, not having to miss work as well. So we try to make it as easy as possible for kids to get well-rounded healthcare right in the schools that they're in all day, every day.
Right, and I would imagine it really takes the load off parents who don't need to go take time off of their own work day, go drive over to their kids' school, pick them up, bring them to an appointment, bring them back. And in a lot of cases, some parents don't even have the flexibility at work to do that.
Exactly, and the transportation. So the other thing that we're going to be piloting is telehealth over at Silverthorne Elementary. So because our sort of little biddies, our younger kids at the elementaries, need that help to communicate with me and any provider who is there. They will be able to have the mom or the dad be on a screen at least to be there kind of in the room in a sense. And so we're piloting that this year, which is it's pretty exciting. I'm pretty excited to start that up.
Right, and so that way if you're explaining medications or kind of what you're finding out as a clinician, then you can explain that to mom or dad.
Exactly. Yeah.
That's great.
Yep.
And so who are the various professionals who are in the clinics?
So we have 2 PAs and 4 NPs, or nurse practitioners. And so that's on the medical side. And then dental, we have various hygienists. There's 3 or 4, depending. I may not be getting the numbers right, but dental hygienists. And then for behavioral health, we have counselors. So they can be licensed counseling social workers, or also just regular LPCs, or licensed practiced counselors.
Licensed professional counselors?
Professional, yes, professional counselors, yes.
We've got a variety of titles. They're all licensed in some fashion.
Right, exactly.
And this supplements the school's existing counseling program, or is it integrated with that, or how does that work?
Each school has its own workflow with the school counselors, but they work together. Usually kids, kind of depends on the situation, but sometimes they'll start being referred to a school counselor and kind of assess their needs. And then if they need a little bit more intensive care, then they'll be referred to us. We even refer out if needed. So we work really well in all the schools with the counselors to make sure, depending on what the child's need is, that they're meeting with the right person and getting the care they need.
Great.
Yeah.
And then in addition to working in combination with the school's counseling team, the whole team works together, so you have an integrated approach. Is that right?
Exactly, and that's sort of one of the bigger sort of aspects of school-based health, as well as the community care clinic. But we've got sort of easy referrals to people in-house as far as dental. If we notice that the child hasn't had a dental exam for years or more than a year, we can refer right to them, and vice versa. If somebody's in for counseling and they end up talking about we're not really getting much for maybe not eating the right foods, and the counselor says hey, can you take a look at this kiddo for me? And so it's really very nice integration that is really for the overall health of the child and keeping them in school and healthy and ready to learn. That's sort of our motto.
Awesome.
Yeah.
Great. So we're talking about school-based health centers, and it's summertime, but that doesn't mean that you don't have plenty of things going on. So particularly in August, what is going on at the health centers?
So lots of sports physicals, lots of immunizations, getting kids up to date on things.
So your doors are wide open.
Doors are wide open. Currently, we've got a couple of days over at the middle school. We'll be starting really ramping up here pretty soon. And so, definitely can make a phone call to our main patient navigator line, 368-1134, or to the main clinic, 668-4040, and ask them for an appointment at one of the school-based health centers.
Great.
Yeah.
And then is it just the sports physicals, or are you open for all kinds of other services as well?
All kinds of other services as well, acute visits as well, parents, staff, families. So
Great.
Please use us.
Come on over here.
Come on in.
All right. And is that true all summer long, or is this specific to kind of this back to school prep period? Or
It's all summer.
All summer.
So, yep, our hours, as Mackie said, are ramping up now. We'll be back to almost full time here in a week or two in the schools. But yeah, all summer long we're open. There's just a little bit shorter hours for the June and July.
Okay.
Yeah.
Great. Well, is there anything else that either of you would like to add about the school-based health centers?
I think that
We've covered
pretty
it.
much covers it.
All right, great. And then remind us of the phone number again if anyone wants to schedule an appointment for any of these services that you've mentioned.
Yep.
So if you just want to call our main clinic, 970-668-4040, we can get you scheduled at any of the schools. If you do have students in the schools, we'll be sending out direct lines to each of the schools to schedule during the school year. But our main clinic number, the 668-4040, is the best one right now.
All right, fantastic. Well, Jenna and Mackie, thanks so much for coming in today and sharing with us about all the services available through our school-based health centers in Summit County, as well as some of our adjacent counties. And thanks for all the great work that you do to keep those centers up and running and serving all the little ones and medium-sized ones across our community.
Excellent.
Thank you for having
you.
us.
Thanks very much.
Absolutely. And thanks to those of you at home who've joined us for another episode of County Connection. We'll look forward to seeing you next month.